Let's get more on this from Myriam Marquez, who's a Brazilian public health nurse in New York. She is one of the founders of the Defend Democracy group in Brazil. It's a group dedicated to bringing awareness to the threats to the democratic system in the country. And she joins us now live from New York. Myriam, we really appreciate you being with us. And we really want to come at this from the perspective of you as a healthcare professional, but also somebody that's familiar with the system in Brazil. How have the politics of that country compounded the health crisis that we're seeing unfold there?
So what is happening in Brazil now? In fact, the collapse of our health system in this worst time to this happen, just in this pandemic. In fact, it came from the last 4 years that we had a coup d'etat in 2016. And one of the main policies of the actual government is just to defund and to destroy the amazing public universal health system that we have. So combined with a terrible economic policies. So Brazil was catching the situation where we have a combination of a big economic crisis and a sanitary crisis because the health system cannot afford so many cases. And at the same time, as we saw in the news just now, as he says, these mixed messages to the people from the federal government.
There are so many parallels that you can draw between the U.S. leadership and Brazil's leadership when it comes to the handling of the coronavirus pandemic. Both leaders, both President Trump and Jair Bolsonaro, have touted the drug hydroxychloroquine as a possible treatment for the coronavirus, despite a lot of health experts saying that there really hasn't been enough data to prove that it does that. What is driving the agenda in Brazil when it comes to the handling of this pandemic? And is it at the influence of the U.S. leadership?
Well, we believe so because since the beginning, President Jair Bolsonaro showed for the entire world his admiration for the Trump administration, the Trump government. Even during the pandemic, everybody knows that in March 7, Bolsonaro came with a big official group from Brazil to have a meeting with Trump in Miami. And from that meeting, they came back with 23 positive cases of COVID. So Bolsonaro is a big admirer of Trump. He has the same mindset, right? Anti-science. Also a president that do not listen to his advisor. Brazil has a very good group of epidemiologists, of public health officers there. Also, he fired 2 ministers of health. So like Trump, he come up with his own mind. He come up with his ideas. He's also obsessively pushing for chloroquine. Chloroquine in Brazil is a drug that we even know better than other countries because we use for malaria, use for cases there. So Bolsonaro and Trump, they have a lot in common. Also, the defund of social policies. Also, the lack of empathy for so many deaths in Brazil. Also, every day pushing people to out of their homes, sending this mixed message and defunding states that need most of the resources from federal resources. So there is a lot in common between them. Maybe there is a little difference because here in the United States, the institutions are more strong and Trump could not go so forward. But as in Brazil, in Brazil, there is no law to stop Bolsonaro doing what he's doing. He's going every single Sunday for more than a month to protests. He even paying his supporters are paying people to go to protest and to open the economy, saying that the debts are okay. He says, "Oh, what can I do?" And so what? People are dying, and so what?
You bring up such a good point, Myriam, which is the fact that the U.S. going into this pandemic had a very strong economy. The healthcare system not ideal, but far better off than what we've seen in Brazil. Brazil's economic and healthcare system was just not set up for something like this. But Myriam Marquez, we really appreciate you coming on to add your perspective. Thanks for that.